Well, I want to thank Debbie's Dream Foundation for the opportunity to come speak with you today about the integrative medicine therapies. Okay, so we'll start with definitions. You know, the terms alternative versus complementary. Is there a difference? Yes, there is. Alternative therapies are things that are promoted for use instead of mainstream treatment for cancer and for other serious illnesses. Unfortunately, they don't work. You know, there are no viable alternatives to traditional treatment. They're usually biologically invasive, they're costly, potentially harmful. Many of them can interact directly with the conventional treatments. And what can happen is if somebody says, well, I'm not going to do treatment, I'm not going to do surgery or chemo, I'm going to try this quote-unquote alternative. We know that the earlier you're diagnosed and receive appropriate treatment, the better the outcome. And so by the time you've tried a bunch of other things that don't work, your cancer is more advanced and is more difficult to treat. The complementary therapies, on the other hand, are used with mainstream care for serious medical illnesses, and they're non-invasive, inexpensive, safe, evidence-based, they're rational, and they are truly complementary, and they support it. So in integrative oncology, we combine the best of complementary medicine with mainstream care. The most evidence-based complementary modalities are the touch therapies, including massage, reflexology, mind-body therapies, music therapy, acupuncture, fitness, which includes both exercise and nutrition, and botanical therapies. Sorry, I'm short, you know. Stop. All right. So our therapies, they treat really many of the symptoms, and not only symptoms that patients who are cancer survivors have, but also, you know, the rest of us and everyone in general. Pain, you know, when I was in Minnesota, Blue Cross Blue Shield of Minnesota would authorize 10 visits to an acupuncturist without, you could just go to an acupuncturist for 10 visits for pain. It was recognized as being that beneficial. Now, you know, so then when I moved to New York, I thought, well, it's the same. No, it's not. It varies from state to state. But anyway, you know, pain, nausea, fatigue, anxiety, depression, isolation, insomnia, constipation, ileus, these things, hot flashes, acupuncture, very beneficial for that, dry mouth or xerostomia that can come with radiation treatment, weakness, shortness of breath, many of these things, okay? So the first one, the touch therapy, massage. This is very beneficial. You know, how many people have had massage? Yeah, most people. Yeah, you know how good it feels. So what we have done at Sloan did a clinical trial actually involving almost 1,300 patients. It was 1,290 patients. It was in two settings. So first, inpatient setting, these patients are more sick, so they received a 20-minute reflexology treatment, which is basically a tailored foot massage using specific points on the feet. And the outpatients had a 60-minute total body massage. And so it was a pre-post test, and we measured patients' complaints on many different symptoms, pain, fatigue, stress, nausea, and depression. And as you can see, post-massage therapy, everything was cut in half. Let's see, here was our, yeah, so pain, fatigue, stress, nausea, depression. You say, well, okay, fine, you know, I've gotten massage, I feel better for a little while, but, you know, it's expensive, what's really the good? So what we did was we followed a subset of 98 patients for 48 hours afterwards, and lo and behold, here, not only was it cut in half, but it stayed low for 48 hours. Now, knowing this, we, of course, would have done a study for a week, you know, to see, well, how many days, not how many hours, but how many days do you derive benefit? So, you know, these things are very beneficial, and even a 20-minute foot massage, the reflexology works. Music therapy, this is not just listening to music. There are many different cancer institutions now that do offer music therapy. This is therapy done by professional musicians who actually, instead of using words, we're all familiar with talk therapy and psychotherapy, they use music. And what's really beneficial, especially patients who are in the ICU or are more advanced at the end-of-life stages who maybe don't have access to words, the music bypasses the whole higher cortical thing, and you can really reach people and get profound healing, not only for the patients but for the family, by using music. And some of it is passive, some of it is active, you know, depending on the patient and their needs and this, but very, very beneficial. We had a very large study looking at depression and isolation and medical symptoms for bone marrow transplant patients, and the music therapy group did significantly better in that. So we have a huge music therapy program at Sloan Kettering, and it's been duplicated at many, many other institutions. So think about this as well. Acupuncture, this is part of traditional Chinese medicine. Okay, now, you know, we always think about the needles, but it's actually not just the needles, it's herbs, it's nutrition, it's fitness, some of the Tai Chi, Qigong, these sorts of things. And what acupuncture is about is it goes on the theory of Qi, that there's a life force or Qi that is in the body, and it passes through these various channels or meridians, okay, like this. And so disease occurs when you get blockage of the Qi. And so putting the needles in certain places, like this is some of the acupuncture meridians, will help to unblock the nervous system or the Qi, and therefore restore balance and health. So, you know, this may look similar to something else that we are familiar with, like the Manhattan subway system. So I live out here, in between the E and the F train, out in Queens, and so when I would go to work, I would take the train and I would end up here. Well, if there's a problem in the subway system in Midtown, I'm going to feel the pain out here in Queens because no trains are moving, all right? But they're not going to send the repairman to where I am in Queens. They're going to send it to where the problem is, which is actually here in Midtown. So same thing, you may come in with a headache and then the acupuncturist is putting needles down in your feet and you're saying, why are you doing that? Well, it's because of the meridians, right? Okay, so this is also similar. All right. So acupuncture, very, very beneficial. As I said, for pain, you know, very well recognized. Also for nausea, that's one of the 10 indications, actually, that NCAM and the government has indicated. So pain and nausea for acupuncture. Xerostomia, we had studied that. Excuse me, this is dry mouth, predominantly post-radiation for head and neck patients, but it can happen for other patients as well. Acupuncture is one of the few things that actually works, and one of the only things that works. Neuropathy, again, peripheral neuropathy, chemo-induced peripheral neuropathy, very, very common, and acupuncture helps to prevent and reverse some of that. Nausea, fatigue, hot flashes, early menopause can happen, you know, with the chemotherapy, and hot flashes can be very debilitating, and this is very beneficial. Fatigue, again, you know, now with radiation, the main side effect, number one for most patients is fatigue, and then you get chest pain and other things as well, but acupuncture is very, very beneficial for fatigue, as is physical fitness, but again, very good. Stress, depression, bowel irregularity. Acupuncture is so balancing that they use the same point for diarrhea as they do constipation. It's down in the leg, lateral part of the shin. So, you know, very, very beneficial. And lymphedema, too. It looks like there's beneficial effects for that. So really many, many things. This is just related to the cancer setting, but many other hormonal benefits as well from acupuncture. Okay, this is a study that was done at MD Anderson looking at lymphoma patients and looking at nutritional adequacy. So food is important. Nutrition is important, but there's a specific diet. Food cannot treat cancer in and of itself, so you can't go on these, you know, nutritional programs. But they did food frequency questionnaires and asked about supplement use and vitamin use, and it was fairly regular in about 2/3 of the patients. And about 18% used herbal or other supplements plus vitamins and minerals. This is an old study, and only about 4% used just herbs. Now, they had done a seminar looking at nutrition and tried to give good nutrition information as well, and 53% reported healthy dietary changes after the seminar, and from just having the cancer diagnosis in and of itself. But what was really pretty horrifying is only 31% of people consumed 5+ fruits and vegetables, not 5 fruits plus 5 vegetables, but total, only a third. And what's even more alarming is that most people, the vast majority, 94%, were consuming either excess or inadequate amounts of our nutrients. And what's the problem? Too much is just as much of a problem as too little, because too much of a good thing is still too much. In this country, we think if a little is good, more is better, and an excess has to be really good, but it's just not so. That can cause many problems. Now, the World Cancer Research Fund and the American Institute for Cancer Research, the AICR is the #1 organization in this country that looks at nutrition and fitness as it is for cancer prevention, and they came out with their major recommendations, and there's 8 major recommendations. The first one is to be as lean as possible without being underweight, because being overweight and obesity is a huge risk factor for many cancers. They also want us to limit our consumption of energy-dense foods, and this is specifically sugary drinks. And many of these energy drinks and, these fancy coffees, you can get almost half your calories for a day in just a fancy cup of coffee. It's amazing. How many people drink coffee? Okay. When I was in Minnesota, it's coffee black. I'm now out in South Dakota, and it's coffee black. But moved to New York, it's regular is cream and 2 sugar. So how many people add sugar? A little bit. Okay, we have 1, 2, 3, 4, 5, 10 sugars. 20, would you? Makes you kind of sick to think about it, huh? Well, a can of Coke is the equivalent of 12 packets of sugar. Can, not the bottle, but the can. And a can of ginger ale has the equivalent of 17 packets of sugar. Doesn't even taste sweet, So when you're reading the label, 4 grams of sugar equals 1 teaspoon. So divide the number by 4, and then you can do the math and then figure about all these added sugars. So these things really, it contributes to a lot of dumping syndrome, as we heard, and obesity, and, a lot of metabolic problems. Diabetes. So these sugary beverages we really have to be careful for. And the fruit drinks and that, you read the fruit juice, it's water and it's sugar and then it's fruit, so it's really not so healthy. Plant foods, we want to have at least 5+ servings of non-starchy vegetables and fruits a day. And remember, I said less than 30, it was 31% of those patients who had lymphoma actually ate that. And how many people here have 5 total fruits and vegetables in a day? So few, yeah. So we really have to work on it. It's not always so easy, Animal foods, we want to limit the amount of red meat and avoid processed meat. Red meat, I'm out now in cow country, and most of the cattle that I see in the cattle ranches driving to and from work, they're black, and I said, oh, it's dairy. No, this is meat, so I'm always sad when I'm thinking, they're going to end up on somebody's plate here, these cows, but we need to limit the amount of red meat, not more than, 2 servings a week, really. And, the grilling and the processing, these things are very, very detrimental ways of preparing the animal protein. So you really do want to watch for that. Chicken is much better. Fish is actually very healthy. We have to be concerned about the mercury content in some of the fish and where it comes from and things. But really, the typical Western diet is not very healthy, and it's a high amount of meat and a lot of potatoes, which are your starchy vegetables. And most of the nutritionists don't even think about a potato as being a vegetable. It's a starch, right? So you really want to do that. And the processing, that's the curing, the jerky, the beef jerky, the smoked meats, these sorts of things, not healthy. Okay, so activity, physical fitness, very important. You can be a couch potato up until the moment you get the cancer diagnosis and then start being physically active, and it's never too late. You still derive benefit. And the data is very, very strong. There's decreased side effects from daily physical fitness, and many of the side effects that we get can be decreased from that. And actually, it increases survival as well. There's a lot of data in colon cancer, breast cancer. We don't have studies yet in gastric cancer, but I can't imagine that it would be any different. Daily physical fitness is very important. You can start with walking. A couple years ago at ASCO, the American Society of Clinical Oncology, Oncology, they presented their recommendations on physical fitness, and they said, you know, they used to say, well, you have to ask your doctor if you can exercise, and they removed that restriction. Why? Because the time it took between you decided, oh, I'd like to exercise, and you actually got into your doctor to say, can I start a walking program, it was so detrimental that it was actually better to just start walking, you know, start your exercise program, because it's, you know, the benefits are so strong. You want to do at least 30 minutes if you can, and start slow and then gradually build up. And you want to do moderate exercise. And what is moderate? You can say a few words while you're exercising. So you could talk while you're doing it, but you can't sing. Okay, all right. The vigorous fitness is you can say a few words without catching your breath, but you know, moderate, you can talk, but you can't sing while you're doing it. So if you're, it's just helpful, you know. Most people walk and saunter. That's not, you want to have a good brisk face. And up in New York, you know, New Yorkers are probably, you know, walk very fast. All right, so it's a good pace. Okay, alcohol. All right, it's a food, it's a poison. It pickles your body. There is really probably no real safe amount to drink. Less is better than more. You don't have to be a complete teetotaler, but I would prefer that you really not have much at all, maybe on, you know, festive occasions. From a public health standpoint, they say less than 2 drinks a day for men and less than 1 a day for women, but I would say even less than that is better. Especially during chemo, radiation, and, you know, alcohol, it's not beneficial, can interact with a lot of things and cause other problems as well. Okay, we already talked about the preservation, the processing, limiting salt and moldy cereals and these things. And then I was very excited to see this last one on dietary supplements, where they say that we should really, as much as possible, meet our nutritional need through food alone. And dietary supplements are not recommended for cancer prevention. Now, if you have a nutritional deficiency, say B12, vitamin D, you know, folic acid, you know, certain things, then yes, you do need to take supplements. Magnesium deficiency, yes, you need to take these supplements, but that's to meet specific nutritional deficiency. Not everybody should necessarily be taking these supplements. Okay. So what about preventing weight loss? Because weight loss is a problem as well. So you really want to, fruits and vegetables, while they're healthy, they don't contain a lot of calories. And so when you want to maximize your calorie intake, you need to be very efficient. So taking some of the higher quality fats, nuts, oils, adding these into the diet, making them into smoothies, you know, that sort of thing can be really very beneficial. Coconut oil is almost, it's about 95% saturated. Saturated fats have gotten a bad rap previously, but they're actually, you know, they have a role. And coconut oil, it's different than palm oil. Palm oil, when you do the atherosclerosis, the hardening of the arteries, you know, clinical trials, that's always your positive control. But coconut oil is really very different. It contains these medium chain triglycerides, which are really very beneficial. And there's a lot of work in the nutritional field looking at the benefits of this. You want to have more of the complex carbohydrates, not your simple sugars, not your white flour and these sorts of things, if at all possible. But the complex carbohydrates will be more beneficial. And think about drinking your calories. The stomach and the body absorbs liquids and things very quickly, and solids much slower. It takes a long time, especially, you know, things like red meat, you know, these steaks and that. You have that, and it can sit in your body for, you know, hours to days, you know, before it's digested, especially with some of the chemos and things, you know, your metabolism is altered. So drinking your calories is a much more efficient way of getting high calorie intake and high nutritional quantities. And then again, you have to work with your body and find out what you tolerate, what you don't. But again, so that's it. And the multiple small meals or multiple small feedings we would talk about, you know, there. And consider plant forms of your protein as opposed to, you know, the solid meats and chicken. Fish is usually tolerated better. The smell oftentimes can make people nauseous, smell of fish, so you may want to have that catered in and not necessarily cook it, you know. So the kitchen smells a lot, you know, that. And then the higher quality omega-3 fatty acids and salmon, walnuts, chia. Okay, so dietary supplements or substitution, you know, okay, all right. All right. I was looking this up. I can't find data past 2012, but in 2012 there was $30 billion that was spent in botanical and nutritional supplements in the U.S. alone. Now, to put this in perspective, in 2010 it was $25 billion. In 2011 it was $28 billion. So in 5 years it went from $25 billion to $30 billion. Now we're in 2015. You know, it hasn't gone down. The question is, by how much has it increased? And so there's a lot of money to be made on these things. They're not covered by healthcare insurance, so it's coming directly out of your pocket. And things come and go in popularity. You know, right now antioxidants are highly marketed, and they're really, you know, very popular. Vitamin D is becoming more prevalent, more popular. That was one of my areas of research interest at Sloan Kettering. So there's a lot of data now showing that vitamin D, repleting the deficiency can help with your immune system, can normalize things. So that's probably important. You don't want to get mega doses. You don't want to overdose on anything, but, you know, keeping normal levels, kind of like Goldilocks. You know, the porridge is too hot, too cold. No, you want it to be just right, not, you know, too much or too little. Things that are popular right now are wheatgrass, goji, noni, acai, selenium, pomegranate. These are all the antioxidants, the mangosteen, the green tea, resveratrol, vitamin A, C, and E. And these have potential to directly interact with our treatments. The antioxidants, radiation works solely through an oxidative process. So you're getting your treatment, you're taking these antioxidants, and it can directly interact with that. And many of the chemotherapy agents as well work through an oxidative process. So you want to be careful of what you're doing and while you're doing it, and not overdose on anything or take supplements without consulting your oncologist, your medical oncologist or integrative therapist. Okay, so there's some few myths out here about the dietary supplements. Number one is that they're far safer than prescription drugs because they're natural. Natural does not mean safe. Arsenic, cyanide, and lead are also all natural. You don't want to take any of those in high quantities. All right, so just because it's natural doesn't mean it's safe. All right. Another myth is that dietary supplements are rigorously tested and their effectiveness is backed by all sorts of studies and scientific proof. This is just hogwash. Most things are not studied. When I was with Sloan Kettering, we had INDs for one of the medicinal mushrooms and also for vitamin D because we were doing high quality clinical trials. Most people do not have the money or the ability to run high-quality clinical trials on these products. There's over 30,000 botanical supplements on the market right now. So, you know, most of these are not studied, right? There's also a lot of money to be made on these products. Greed is a great motivator for many people, and, you know, it alters their perceptions on things. The third myth. Oh, let me go back to myth 2. In 1994, the DSHEA Act, the Dietary Health Supplement Education Act, took the realm of supplements out of the control of the FDA and made them generally recognized as safe. Okay, so you can buy things on the market, and the FDA retained the right to remove something from the market once it has been shown to be detrimental. Okay, remember Ephedra? All right. When I was still back in Minnesota, Corey Stringer was one of the overweight Minnesota Vikings. He died from an overdose of Ephedra. Okay, trying to get in shape really fast for a football season, you know, took an overdose. Well, you know, the acupuncturists have used Ephedra for millennia for asthma and for many things, and in appropriate use, it's fine. But again, you know, overdosing on anything or just, I can buy it on the in the grocery store now, you know, practically. Gas stations even can sell supplements, but you know, just because it's available does not mean that it's safe. So you have to be very, very careful about what you get. Just because you can buy it doesn't mean that it's for you or beneficial. Third myth, supplement makers are knights on white horses riding to our rescue while the pharmaceutical industry is evil, okay? This is the perception that they give you, and that's not true. You know, there's, as I said, a lot of money to be made from the supplement market. This is one thing that I got. This a cure for cancer hemp oil. This is you know, propaganda. I'm not even going to tell the person's name, but hemp oil. No, it doesn't work. It's not a viable treatment. And they have this person says, oh, he was cured and this, that, and the other thing, and so he's giving away millions of dollars worth of this stuff. Okay, hogwash. It's just nonsense. Okay, because dietary supplements are not regulated by the FDA. They don't have to go through rigorous proof to show they're A, safe, B, effective, or you don't know the many of the side effects except for when people run into complications. And so there's nobody policing the market. There are two independent companies. One is the USP, the US Pharmacopoeia. The other one is Consumer Laboratories. That's this one. All right, so these are about 5 to 7% of the dietary supplement manufacturers will spend a lot of money to send their product to one of these two companies, and they will analyze it to show it's doesn't talk about safety or efficacy, but what it will tell you if you see either of these logos on the bottle, that what's in the bottle is the same thing on the label, that they use good manufacturing processes, that they're tested for bioavailability. They don't have added stuff in there. Many of these supplements have, you know, real drug like steroids, or, you know, a lot of the stuff for erectile dysfunction has Viagra in there. You know, I mean, it's just craziness. But anyway, so it tells you that what's in the bottle is the same thing on the label, nothing else added. All right, so look for these two things. All right, so some food fads and myths. Is it really sugar feeds cancer? If it could only be that simple, it would be wonderful. But no, it's not that simple. No, you know, our body runs on glucose. You know, the energy in our cells, it runs on glucose. So, you know, you could fast and drink only water, and your body will break down the fats and proteins into glucose. Now, does that give us a license to take massive amounts of it? No, absolutely not. But it's not that simple. So, you know, and sugar can cause the dumping syndrome. So there's many, many reasons why you don't want to take large amounts of processed sugars, but it's not necessarily evil. We need some, but not too much, right? And depending on the type and the quality as well. Can the acid-alkaline diet change your blood pH? Absolutely not. The stomach pH is 2, and that's pH that it needs to be to digest the foods. And if you take a lot of bicarb and all these other things, it's just going to induce your stomach to make more acid, and it's just craziness. How about the Paleo Diet? This is another one of these food fads, along with Gerson therapy. Paleo Diet, actually, many of these popular diets were ranked as far as livability, and the Paleo was the worst. This is going back to the caveman diet, and you don't have, you know, many things, anything that caveman didn't eat, you also don't eat. And it's, you know, many of the refined things, and it's just fresh fruits, vegetables, it's just, no, you know, this is mostly red meat, and it's not a healthy diet, not livable, and certainly not for anybody who has cancer. Gerson therapy is a bogus treatment. It doesn't work. Please don't. There's a lot of stuff on that on the internet. Please don't use this. Budwig diet is high amounts of cottage cheese and flaxseed oil. No, it's not a treatment for cancer. It's and many people who actually prostate cancer, you need to limit dairy, so it's very detrimental for them. So not good. Will coffee enemies be helpful? No, not at all. Actually, it can cause a lot of problems with electrolyte disturbances, cardiac dysrhythmias from, you know, altering the potassium and the magnesium levels in your body. Can asparagus cure cancer? No, it can't. No. Pureed asparagus, raw asparagus, juiced asparagus, no. Asparagus is a healthy vegetable, but look at it as a healthy vegetable. It's not a cancer treatment. It's not chemo. It's food, okay? Is hemp oil a miracle? No, we talked about that. All right, so complementary medicine at the NIH, there's 3 different websites here. They have good, solid information. Another website is the Integrative Medicine Service at Memorial Sloan Kettering Cancer Center has an About Herbs website. There's a free app that you can download for your iPhone and iPad. This has won many, many national awards for its scientific merit, and it has high-quality information for you. So in summary, integrative therapies assist with many of the symptoms that cancer patients experience. Families and patients both benefit from these therapies. Remember, acupuncture, it can be very, very beneficial. Check into your insurance, because many times this is covered. Massage, reflexology, Reiki, these are the touch therapies, very, very beneficial. Mind-body therapies, also very, very beneficial. I didn't get to talk about those, but they're really good. Music therapy, very important, especially a more advanced end of life, or if you're more debilitated, you know, don't have access to words. Really, very, very profound healing we can get from that. Not cure, but healing. Healing is making one whole. That's a goal. We all need to be whole. We all need to be healed. Okay. And then herbs and botanical supplements are not for everyone. They are. I use them a lot in my practice, but we have to be selective. And that's so. Thank you for your attention, and I'll be happy to take any questions.
Thank you. So do we have any questions from the audience? We have one in here, and I have some online.
I've actually got two questions. First, a couple of years ago, there was a diet gaining popularity talking about anti-angiogenesis foods. Have you heard anything more about that? And the second is a food alternative that was recently on NPR called Soylent. This is not the movie Soylent, but it's a food alternative. And have you heard of that?
Okay, the first question was anti-angiogenesis. Yeah, there are chemotherapy agents that work specifically on anti-angiogenesis. It's an interesting concept. Problem is things like low copper diets, you know, low magnesium diets, these sorts of things. It's when you cut out foods that contain things like copper. I had one of my patients specifically ask that. We were monitoring copper levels. I mean, there's no clinical evidence. I don't know. How do you interpret the numbers? You know, you don't have data to help support this. You're cutting out many of our nutritional foods that you get, you know, high levels of other things like, you know, nuts. How can you, you know, especially if you are limiting the amount of animal proteins in your diet, then how are you going to get adequate protein? And then you take out nuts as well, you know, these sorts of things, or legumes, you know, so, all right, the plant forms of protein. So it's not, it gets complicated very quickly, and you have to look at nutrition as a whole and not just one isolated thing. We try and be very reductionistic in many of the clinical trials, and you look, you know, one drug, one receptor, one result, but it isn't that simple. Our body is very complicated, and with nutrition especially, you know, if you are looking at one specific nutritional deficiency, it makes it a little easier, but you know, there's feedback loops and mechanisms, and so you alter one thing and then you put this other cascade in effect, and so it's very difficult to control for these things. And I wouldn't advocate doing specific, cutting up large groups of food, because especially if you're already restricted in your ability to absorb certain foods, you know, and things, and then you restrict that even further, then you may end up setting yourself up for more difficulties and having your body be less resilient and less able to tolerate the treatments that you want. You know, look at these things as supportive, but not as a mainstay of treatment. Okay, keep that, you know, it's a different hat that you're wearing. You're supporting your body to help it be as resilient as possible so that your oncologist and your surgeon and your radiation oncologist can give you the treatment that you need to, you know, have the best outcome. The second one is on food. I'm not familiar with that one specific nutritional supplement. Again, there's a lot of marketing for these products. If you can get back to using whole foods as much as possible, I think that's the best, because, you know, when you isolate certain things, you know, it's just, like there's 8 forms of vitamin E, you know, 8. When we take a supplement, most often you're getting 1. And then you're getting the alpha-tocopherol. Well, that decreases your gamma, and the gamma is the one you want. You know, whereas if you eat whole foods that have vitamin E, you're getting all 8 in a normal balance, the way that Mother Nature intended it to be. So many of these things that are like food replacements, maybe in the short run or as a supplement for a meal replacer for a meal, but I wouldn't look at it necessarily without clinical data and support from good registered dietitians, registered nutritionists. Okay, thank you.
Great, thank you for that. We have an online question from Sandy Schneider. She asked, does Dr. Wessa recommend probiotics for gastric cancer patients? And if so, what does she specifically recommend?
Oh, yeah, question of probiotics. Very, very interesting. Do I recommend it? Yes and no. There's more clinical trials, out there now. The previous studies were not as helpful. They were looking at advanced patients who are in the ICU from pancreatitis. Okay, and so giving, this is a very sick group of people, getting lots of antibiotics, so then they were giving probiotics to try and counteract the effects, and there were actually more deaths and longer ICU stays in the probiotic group than in the placebo group, which was, put strong realm of caution in a lot of folks, but now there's more research in this. I think that they do have a role. Certainly eating fermented foods, that if you can do it through food, that is actually the best, I think, because that's the most natural. So, your sauerkraut, your yogurt, your kefir, these sorts of things. I'm not such a fan of the fermented teas. That stuff can be bacterial contamination and sprouted things, again, especially if you're neutropenic, you need to be careful. And you always have a concern of translocation, which is you're giving active bacteria to the body, and if you have inflammation in your gut, then there's a danger of the bacteria going from your inside of the gut through the bloodstream and giving you blood poisoning or bacteremia or sepsis. And so that can be a real problem. The other part is, what strains and how many? How many billion colony-forming units do we need? Is it 10? Is it 20? Is it 50? Is it 100 billion? I mean, you'll find all sorts of different varieties on there, and is it just, we don't know. Do you need 10 strains, 20? It's not that, the science is not that exact yet. I think that if you can eat the fermented foods, that's the best. If you can't, then, and you have a normal white count, then going with some moderate dose of like 30 billion or 50 billion, at least 10 strains is not an unreasonable thing to do. But again, with caution. And if you're not tolerating it, then, stop, definitely. They're expensive too, so you can spend, quite a few dollars a day on some of these supplements, and they may not be beneficial. Whereas, nobody gets into trouble if you're eating yogurt, if you're having sauerkraut, right? It's just.
Yes, thank you so much. We have a lot of questions here. I'm going to take one. He says, you said avoid moldy cereals. What are moldy cereals? It was on one of your slides. Okay, sure. Yeah, the moldy cereals. This is not such a problem like in the Midwest, but in the southern part of the country where they have farms where the silos hold the grain for a long period of time, in it's high heat and high humidity, things mold, right? And so that forms aflatoxin, and that with people who have Hep A or Hep B is a huge risk factor for liver cancer. So it's the aflatoxins, and actually casein too. Many of these protein supplements use casein, which is isolated form of, it comes from milk protein, but it's the whey actually that is safer. The casein is probably not as safe. T. Colin Campbell looked at that when he was doing his studies on liver cancer, and the casein, specifically isolated casein, causes more problems with liver cancer. So you just want to have, don't let your bread mold. Don't eat moldy grains, moldy cereals. Most of us, don't do that anyway. But in the third world countries also, it's a big problem. Great, thank you. One more question here, and then I have two more questions. Please, in the back.
Dr. Wessa, what do you recommend the vitamin D level be normally?
Okay, excellent question. Yeah, that's based on the current state of clinical research, I would say optimal level for most people is 40 to 60 nanograms per mil. There's controversy as far as what is deficient, what is sufficient, these sorts of things. Certainly levels above 100 are probably more toxic. You can have problems with constipation, kidney stones, certainly. Also soft tissue calcifications if your level is too high. Too much of a good thing is still too much. You want to have a level probably 40 to 60. For people who are older and elderly, a level less than 40 nanograms per mil is a huge risk factor for falls, because you get proximal muscle weakness and ataxic broad-based gait, you get neuropathy, all sorts of problems when your vitamin D level is less than 40. 40 to 60 is a reasonable target. Some women who are on aromatase inhibitors need a level of probably like 80 to really decrease the incidence of the aromatase inhibitor-associated joint pain or AI-associated arthralgia. You know, there's this, you know, these women feel like they're 150, they can't move, you know, because of the joint pain with their medications, and they do need a higher level of vitamin D. And in some instances, I will try and run people higher, but for the most part, 40 to 60 is a reasonable target range.
Very interesting, right? One of the other things I wanted to ask, actually, if you can answer this question, how should a gastric cancer patient find a qualified integrative medicine expert? Because, you know, as you can see, you know, she's from Memorial Sloan Kettering, and I'm sure that many of the patients would love to go and see her, but, you know, we're, you know, patients from all over the world. So where would be the best place for them to find a qualified one? Go ahead, yeah.
So I would say to speak with your oncologist. There's many of the cancer centers have integrative medicine therapies. Certainly, you know, MD Anderson, Sloan Kettering, you know, many of the other cancer centers as well, Cleveland. Ask them about nutritional, the nutritionists, the dietitians. They also have ability. I would probably, that would be my first thing, really. There isn't like an association of integrative therapists. The Society for Integrative Oncology was founded by Dr. Barry Casleth, who was our former chief of integrative medicine through Sloan Kettering. You could look at that website, integrativemen.org. It's the Society of Integrative Oncology. They would have access also to practitioners who are members, and so that would be another resource. The SIO members are actually many different oncology subspecialties. There's radiation oncologists, there's surgeons, there's, you know, medical oncologists. So you know that I would start there, really.
Great. Thank you so much for that.